Turns out, prostate cancer and the partners we forget. When a man gets diagnosed with prostate cancer, his life changes. But here's the thing nobody talks about. His partner's life might actually get worse. We're talking depression, anxiety, sexual dysfunction spreading between two people like some kind of emotional contagion. And for decades, medicine basically ignored half the equation. A massive new randomized trial just proved that was a catastrophic mistake. So what exactly did researchers discover when they finally started treating couples instead of just patients? Prostate cancer is the most common cancer in men who aren't dealing with skin cancer. It kills more men than cervical cancer kills women. The survival rates are actually pretty good for early-stage disease. Most men live. But, and this is the crushing part, most men who survive also live with lasting side effects. We're talking sexual dysfunction that doesn't go away. Incontinence, bowel problems, psychological torment, depression. And partners? Partners watch their spouse suffer. Partners shoulder the emotional weight. Partners watch their own sex life disappear. For years, medicine treated these men in isolation, like they existed in a bubble, without anyone else depending on them. This study asked a simple question. What if we stopped treating prostate cancer like a solo disease and started treating it like what it actually is, a couple's crisis? Led by Dr. Lian Song at the University of Texas at San Antonio, alongside researchers from Northwestern, University of Michigan, and the University of North Carolina, this team spent years building and testing something called PACE, the Prostate Cancer Education and Resources for Couples Intervention. It's a web-based program designed specifically for both the patient and their partner. They published their results in the Journal of Medical Internet Research in July 2026, and the findings reshape how we think about cancer support. Here's what they did. They recruited 280 couples, 560 people total, through the North Carolina Cancer Registry. These weren't newly diagnosed men. These were men who had just finished treatment for localized prostate cancer. Real people dealing with real aftermath. The researchers randomly split the couples into two groups. One group got access to the PERC eHealth platform. The other group got standard care. The PERC platform wasn't some generic website. It was tailored, personalized. Couples logged in and received content specifically designed for their symptoms, their stage of cancer, their specific side effects. Information for the patient. Separate information for the partner. Communication exercises for both. It's like the difference between a book everyone reads and a conversation designed specifically for two people sitting in your living room. The study ran during COVID, which meant most of this happened entirely online. No travel, no in-person sessions, just couples at home, using their devices, working through the stuff that was actually destroying their relationship and their quality of life. They measured outcomes across multiple domains: physical symptoms, sexual function, emotional well-being, relationship quality, general quality of life. They tracked this stuff for months. The results were genuinely striking. Patients using PERS reported significantly better sexual function than the control group. We're talking about a clinically meaningful improvement, not just statistically significant, but something a real person would actually notice and feel grateful for. Partners showed even more dramatic improvements. Their anxiety decreased, their depression scores dropped, their own sense of control and agency improved. One of the most powerful findings: couples who used PERSI together reported better communication and stronger relationship quality. The intervention didn't just help individuals, it helped the dyad as a unit. The effect sizes weren't tiny either. Partners in the PERCS group showed improvements in psychological distress that were comparable to what you'd see from therapy or medication in other studies. Patients reported better sexual function than control groups by margins that would meaningfully change someone's intimate life. The platform was being used during the pandemic, which meant no opportunity for in-person follow-up or face-to-face coaching. It was just a website, and it still worked. There are important caveats here. The study enrolled mostly white couples with higher education levels and better access to technology. The results might not translate as neatly to populations with less internet literacy or more financial strain, and we don't know yet how long these benefits last. Did couples continue improving after the intervention ended, or did gains fade? The study measures that, but long-term follow-up data takes time. Also, this was one specific intervention at one specific moment in time. PERC worked. But that doesn't mean every couple needs this exact format or content. Here's what's genuinely radical about this research. For generations, medicine treated cancer like an individual disease happening to an isolated patient. Partners were afterthoughts. Support groups were optional. Therapists were nice to have. This study suggests that's backwards. When you actually measure what matters to people living with prostate cancer, it turns out the quality of the partnership matters as much as the quality of the medical treatment. Partners aren't collateral damage from cancer. They're central to whether a person actually recovers psychologically and sexually. The study challenges a massive assumption in oncology, that we can treat disease in one person while ignoring the ecosystem they live in. The bigger question this raises is uncomfortable. If couples-based interventions work this well for prostate cancer, why aren't we doing this for every cancer? Breast cancer, colorectal cancer, ovarian cancer. How many partners are suffering right now because medicine is still treating disease like a solo sport? How many relationships are imploding because nobody thought to address both people? This study doesn't answer those questions, but it makes them impossible to ignore. The most mind-blowing part of this research might be the simplest. A website worked, not a specialist flying into town, not an expensive therapy program, not a medication with brutal side effects. Couples sitting down together, working through tailored content online, actually got measurably better. That suggests the barrier to helping prostate cancer patients and their partners isn't complexity. It's attention. We weren't looking, we weren't measuring, we weren't building tools. Now that someone finally did, the payoff was huge. Turns out, scientists have been busy, and they're not done yet.